Hi everyone, I'm Alan Fleegal from Bureau of Health Statistics and Research. I'm going to be showing you how to access a lot of the data we have for cancer incidents, and it's specific to Pennsylvania. I do have a couple handouts. I'll pass this folder around. There's two, one on each side. Just grab one of each, and I'll start off right here. The first handout I have is entitled Pennsylvania Health Statistics on the Internet, and it's not necessarily specific to cancer data. It's a lot of the other different data sources that we have available on there. We do have something called Healthy Stats, which I recommend everybody sign up for. What that is, some of you may already be on there. We send out an email message informing you of the most recent updates that we have on our website, and it includes cancer statistics and our statistical news. And we send that out about 5 or 6 times a year, so it's not like you're getting a lot of overwhelmed with email messages or anything like that. The second handout I have is on EpiQMS, and I'll try to bring this up today and show you guys how you can actually pull data out from there. And I'm also going to show you our website. If you've ever been to our website, you'll see that the statistics are readily available out there, and we have quite a bit of information in terms of aggregate statistics. So again, the first handout was on EpiQMS. I'll try to make sure everybody who is listening on the telephone gets copies of these two documents as well. This just summarizes how our interactive website works and gives you some basic information on it, including a web address to get there. The second one, I'm going to go ahead to our internet address and show you where you can access a lot of our statistics. Okay, when you come to the health statistics area on our webpage, this is what it looks like. We have a lot of different health data out there. You guys are probably most interested in cancer data. So in the body of the page, we have a link for cancer data here. And when you come to the cancer statistics page, the first thing you're going to see is a list of the different reports we put together. These are all statistical in nature. I'll try to just go through some of these very briefly. We don't have enough time to really view them or get a sense of them, but the cancer statistics standard output tables are really very detailed frequency counts that we have. You can get data at the county level, you can get race data, you can get also down to the municipality level data. These are just frequency counts that you can find in these tables. We have both incidence and death data in there. They're very, very detailed. A lot of times we can get the same type of information out of EpiQMS. There may be a few things that are in these reports that you cannot find in EpiQMS though. Moving on to the brochures here. We have 6 of these for different cancer topics, and these are just 2-page brochures that really summarize a lot of the information we have for melanoma, breast cancer, colorectal, lung, prostate, and cervical cancers. They include incidence and mortality trends. They do a comparison to U.S. data, and they also bring in some any screening data that's available or information that comes from our behavioral risk factor survey data. And they're very nice because they're 2 pages long, and it gives you a quick summary of the information. I highly recommend them for those 6 particular cancers. Okay, I'm going to open one up just to give you a quick look of what the brochure is. So if I take female breast cancer,
and then maybe also open up one of the tables too, so they can get that data, how that's sorted.
okay, so it's incidence and mortality trends. Any summary information is given here, and comparison with U.S. data follows. And also information on stage data as well as behavioral risk factor data for breast cancer. That includes whether or not they've had a breast exam or a mammogram within certain time frames for age groups. We also compare that to what we have goals that are set in place and show where we stand here. You can see for Pennsylvania, we still haven't met our goal of 100%. We also have some information that came from the Healthy Woman program as well. I want to keep moving here, though, because we have a lot of information to get through, and I really want to get to the point where I can show you guys EpiQMS and walk through a couple examples.
What's the cycle on the updates on these documents?
A lot of them are annually. See, some of our other larger reports are like the Pennsylvania Cancer Incidence and Mortality Report. This includes very detailed information for all 23 primary sites. I think there's an 8-page summary on each of these cancer sites. This is a very good report for finding detailed information. The analysis of cancer incidence report is really focusing on county level data and determining which counties have significantly higher areas of cancer or significantly lower areas of cancer. And we also have a facts and figures report, which is kind of loosely based on what American Cancer Society does. We do some projections for the current year, and we also bring in incidence, mortality data for cancer, as well as behavioral risk factor data. And we have a similar brief report for African Americans in Pennsylvania as well. And most of these get updated on an annual basis. What I really want to show you guys, though, and spend time with is the EpiQMS system that you guys may have seen before or heard about. What this is an interactive site where you can pull out specific data that you're looking for. You don't have to go through an entire report. You can, maybe you're looking for something specific and you just want to find that data. This is menu driven, so you make your selections and you can build a table to exactly your specifications. And we have a lot of links on our website. You'll see like a globe icon that says EpiQMS. I'm going to go in there now. And I think we're a little bit ahead on time here, so maybe I can spend a little bit of time and show you guys how to create a few of the examples I have in here. You first come to a welcome page. There are a few requirements to use the system. You need to have, if you want to do charts or maps, you do need to have Adobe SVG Viewer on your system. If you just want to do tables, there's no requirements other than to have Internet Explorer installed on your machine. There are more data sets in here besides cancer incidents. The two that are probably have the most interest to this group are probably cancer incidents and perhaps deaths. You could also get some screening data out of the behavioral risk factor surveillance system. I'm just going to focus on cancer incidents today. And you can see that the directions are written right into the system step by step. The first step is choose cancer incidents as your data set. For geography, we have a choice of county / state or municipality. The municipality data is not very detailed in this system. It's limited to frequency counts. The county and state level data, however, is very detailed. And in fact, you can get stage data, information on age group, county, and race data in there as well. And I think we have about 70 plus cancer sites that you can choose from. The data view, this is whether or not you're doing a table, chart, or map. We also have some tools called County Assessment and County Profile, which are basically combinations of maps and charts. I'm just going to focus on table for the time being. And I'll try, if I have enough time, I'll show you some charts and maps. Once you make your initial selections, you'll see you have menus going around here, and there's also directions written right into the thing. So if you're new to this, you could read through the directions. It's pretty self-explanatory, I think. I usually work counterclockwise when I'm making selections in here. So I would start off with my primary site. There's about 70 different sites in here. You can scroll through with the menus to find them. There's an ICD codes button up here that will list all the cancer sites we have in the system and how they're grouped according to their ICD coding and histology.
Is that just a reference and not, like you can't select them?
That's correct. It's just a reference here. We can select, though, from the Once we're in the menu here, though, I'm going to do an example right now where I pull out some, build a table for female breast cancer, and I'm going to pull out all the different county level data that we have for that. So I scroll through my primary sites, I select breast. For my rate and ratio, I'm going to keep that on age adjusted, so I can get some age adjusted rates. It also includes frequency counts and information on the population. You have a year menu over here, and for your county and state menu, I'm going to select all the different counties that are in here. And you can do that by either using the shift or control button. When you click in here, you can pick different counties as you want. Sometimes if I just want to see all the counties, I'll just drag from the top down to the bottom like so. And I'm going to select females since we're looking at breast cancer. And there are make table buttons in here. There's actually two on the same page. It's a little confusing. There's a make table button at the bottom down here, and there's also a make table on the right-hand side of the screen as well. They're the same thing. So once I do that, the data is pulled out that I told the system to pull out. It's 2011 for all ages, female, breast cancer, and the information I get is going to be the in situ number, the invasive number, which is usually what researchers are focused on and consider to be the burden. We have an expected value, which is if a county had the same rate as the state, that's what we expect the count to be. And if you guys aren't sure what some of these headings mean, you can click on them. I clicked on expected, and it'll give me a brief description of what the expected value is. We also get the population for the particular counties that we selected and our age-adjusted rate. And past the rate, you have the lower and upper bound. I think our screen's cut off a little bit here, but that's just the measure of the error that goes along with the rate. You'll notice that some rates in here are highlighted in red. And what this means is we did a significance test behind the scenes, and it's indicating that for these counties that are highlighted in red, such as looks like Bucks and Butler County, they were significantly higher than the state rate was. The state rate was 128.1. Well, these were a bit higher, enough to be significantly higher. These might be areas where we need to do more research or areas of concern. The ones that appear in blue are just the opposite. They're significantly lower. Sometimes you might see something that says ND, and that means we did not calculate a rate. You can see the number of cases for Forest County was only 6 invasive cancers, and it was not enough data for us to calculate a reliable rate. So because whenever it's less than 10, we decided to not calculate values. So I'm going to do one more example where I pull out some stage data now. I'm going to look at colorectal cancer for this. So again, I'm working counterclockwise, like I said, with these, it's a menu-driven system. And for this one, where the rate ratio is, I'm going to select percent staging distribution this time. I'm going to choose 2011 data, and I'm going to look just at Luzerne County. The stage menu down here became activated when I selected this, and I can select the different stage values down here. And I'm hitting the Make Table button now. And you can see we have a small table here I created. The stage categories I selected were in situ, local, regional, distant, and unknown. We have the frequency counts of colorectal cancers in Luzerne County. And we also have the percents here. And Does anyone have an idea why some of the percents are red here? It's pretty much the same thing as with the age-adjusted rates. That means that it's significantly higher than Luzerne is higher for those red ones than it was for the state. Now, red doesn't necessarily mean it's bad, though. We want to find cancers at an early stage, and situ is a very early stage, and it was significantly higher than the state. So actually, that's a good thing when we have an early stage in a red value there. It's significant. There's more early stages being detected in Luzerne County than there are at the state, percentage-wise. However, they also have a lot of distant stage cases there, and that was in a red color too, indicating they had a lot more distant stage than the state did. One other feature I'll mention, when you're building different tables like this, maybe you're working on a report or doing some further work with the data, it's very easy to copy the information out. We don't have an export button at this time, but it copies very well into Excel. And what I usually do is I just highlight the table with my cursor like so and do a copy, and then you can proceed to paste into Excel. And there are some directions. There's always directions built into this system. It's very good about doing that. We have information on how you can copy the data into, they talk about copying and pasting the data into different software. Sometimes with the charts and maps, there's an extra step involved, and I would recommend reading the notes at the bottom if you're going to try to copy a chart or map out. I'm going to move on to charts now and try to show a couple examples here. At any time, you can go back to the beginning screen if you wanted to select a different data set by selecting data set and geography. I can also go directly to the chart and map views from here. I'm just going to go back to the beginning so you guys can kind of see how the system works. I'm going to choose cancer incidence, and I'm going to, for my data view, I'm going to choose chart this time. We have a different set of menus now that appeared for this particular data set. But again, you can work counterclockwise with most of these. The directions are right in there. And I'm going to pull up an example where I do a vertical bar chart for bronchus and lung cancer. And I'm just going to look at some different age-adjusted rates by race. And so I selected brung and longus. For my rate, I'm just going to keep it on age-adjusted. I'm going to choose vertical bar for my chart type. You do have a choice of horizontal bar, a trend line, and also a pyramid chart. Pyramid chart usually works good when you have two categories like males and females. This one section in here that says chart variables, you don't have to make a selection in here, but if you do select two variables in here, you can make multiple choices in those particular menus. Right now, I'm going to choose county and state for the first one, and I'm going to choose race for the second one. So what that allows me to do is to make multiple selections for county and also multiple selections for race. Any of the other menus like age and sex, I can only choose one category right now. But you can get multiple selections when you choose these by variables that are up here. So I'm going to choose Pennsylvania, and I'm also going to choose Philadelphia. And I'm also going to go down to the race menu and choose some different race groups here. And there's a draw chart button that I'm going to use to draw our chart. And there's also a few options you have on your chart. You can see this doesn't start at 0 down here. I can force it to 0. I can show a data table, and I can put value labels on. I'm going to hit draw chart again so those things appear. Now the chart is starting at 0, and we have our different labels appearing here. When you hover over something too, you get information on what that bar represents. In Philadelphia, it looks like the white rate for bronchus and lung was actually significantly higher than the state. The state was 65.0 for their rate with this pink bar over here. For Philadelphia, the pink bar was 82, and that was significantly higher than the state. That might indicate an area where we need to do more work or try to reduce the burden of lung cancer in that particular area. A lot of times that's due to different smoking rates, of course, being lung cancer.
Are you able to select multiple years for trend data?
You can. I guess I could show an example of a trend chart here. Let's say we wanted to look at bronchus and lung, and I'll choose trend line up here. Now when you choose trend line, our chart variables, the 1 is always forced to year. So we're always going to have year. By default, all the years are selected. Our data goes back to 1990 in this system. I forgot to mention that on the tables. And you also have an option to do 3-year summaries. If I switch to 3-year summaries, you can see we have a bunch of periods listed. That only goes back to the 1997 period. I'm just going to keep it on single for now, though, and oops. I'm going to select those years, and I have county and state. Maybe we can just do a comparison right now with Pennsylvania to Philadelphia. Okay, it's selected from my previous example. In my race menu, I'm going to choose whites since we had that significantly higher result earlier. And you'll see now that the Pennsylvania line is at the bottom here. And Philadelphia, for whites, the rate has been significantly higher since 1990, it looks like. If I choose a different race group, I'm going to try blacks in Philadelphia. You can see that it looks like in the past, Philadelphia had some higher rates among blacks compared to Pennsylvania as a whole, but in more recent years they seem more on par and seem to line up more. So there's really there's endless amount of different data combinations we can think of with the EpiQMS system here. I'm going to move on to try to get some map examples in here. Now, I will mention you can copy these charts out. You don't necessarily have to have these labels on. Sometimes the labels get a little cluttered here. But you can turn the labels off if that presents better. You can also turn table feature on and get that same data. Perhaps you want to build your own charts. Well, this is the data that was used to build that particular chart right there. So I'm going to click on, just to give you an idea about these controls up at the top here, there is a help section up here. If you wanted to go back to the table module, you could. I'm going to go to the map section now and do a quick example. I'm going to look at colorectal cancer, and I'm just going to look at the basic rates across the state. So I'm going to keep my rates. Most of the time when you're in EpiQMS, you can keep this rate on age-adjusted rate. The other choices are standard morbidity ratios, stage and distribution. You can get age-adjusted stage and rate as well. I'm going to do a 3-year summary. And let's see here. You have choices there's a little bit less choices in here. It looks like we don't have race data available for the maps. A lot of times with race data, we don't always have the population, and there's a lot of missing data when it comes to race data. It's usually pretty good for larger areas like Philadelphia. Some of the rest of the state, we just do not have a very big population by race, and because of that, we don't have a lot to show on the maps. So here's our map, and we have 4 different ranges that it was broken out into. And you can kind of see that the orange categories are higher areas of colorectal cancer. You can hover over top of any of these counties to see what we're looking at. Looks like Lycoming here, where I'm hovering over right now. And this is Luzerne. Notice that Luzerne shows up in red when I hover over, and that indicates that it's significantly higher than the state rate. The state rate is listed right above the map. It was 45.1. Looks like Luzerne was a bit higher at 51.8, enough to be significantly higher. There is a nice feature in here where we can build a map just showing those significant differences by checking this box up here on the left-hand side. And now you can see there's Luzerne. There was also Schuylkill and Cambria, Delaware County, and Philadelphia County all had significantly higher rates for colorectal cancer. In this particular one, there was no, I guess there was some significantly lower is shown in yellow. So up in Erie, Beaver County, Center County, and a few other counties on the east side here, we had significantly lower than the state. Ones that are orange did not have any meaningful difference from the state rate. These can also be copied fairly easily into like Microsoft Word or PowerPoint and Excel, different softwares like that. I do recommend, if you're going to try to copy out a chart, you read some of the directions down here. You have to copy it as SVG. When you right-click, you'll see Copy SVG. And when you paste it into your other software, you'll have to do Paste Special and choose, I think it's, let's see. I guess you have to use Paste Special when you're copying it into your Excel or something like that. If you want to see a data table behind the scenes for the maps, there's a data table button that appears up here. And you'll have a list of all the counties now. Again, you can see which ones are red and blue right away. Let's see. There's a few other features with the maps. Some of them are kind of limited, but you can see some of the major cities just by clicking on city locations. This just shows some of the larger cities in Pennsylvania, Pittsburgh, Lancaster. It just gives a little perspective to the map. You can zoom in different amounts here. Maybe you're just focused on the southeast corner. You could zoom in, and then you can slide this little box around. Zoom into the southeast corner here of Pennsylvania. Maybe you're focused in that particular area and want to include something like that in one of your reports that you're working on. There are a few other options you can do with EpiQMS. Basically, all the information you can get out of the table section now. There's nothing additional really that are in the charts, maps, or the county assessments that you can't get out of the tables. The tables really have all the data in there. The charts and the maps are really just another way to present that same information. The maps are nice because it just gives you perspective of the state as a whole and breaks everything down to the county level. You do need the Adobe SVG viewer if you're doing charts or maps. The table module, though, should work without installing anything additional. The county assessment is really just a combination of significance testing at the county level, and maybe you just want to know in a particular county what cancers are higher in Allegheny, are higher in Allegheny than the state. So I would select Allegheny, choose age-adjusted rate, significantly higher. You can do different years, different sexes, different races. And when I build this table, it's pulling out all the red rates that we had talked about. And it's telling us that, well, for Allegheny County, breast cancer, bronchus and lung, eye, and a short list of other cancers. These are the cancers in Allegheny that were significantly higher compared to the state. There's a little button over here, too, that says show trend. So if I want to look at breast cancer, I really should have done this for females to see if female breast cancer is higher in Allegheny. And it is. I'm going to hit the show trend button now. You can just bring up a trend line to see how things have been progressing over the years. This maybe looks a little dramatic here. I'll point out the scale isn't starting at 0 in this case, but you have seen that the rate has dipped a few years back, but has gone back up since. I'm just hovering over the points to see which ones are significantly higher. Looks like the ones towards the ends and here were both significantly higher than the state. There's also something called county profiles, and when you build a county profile, if I choose Allegheny, it gives me a series of charts, maps, and a table. A lot of times people want to build their own, do their own analysis, though. It's just kind of a quick way to get some statistics for that particular county. So it gives me a trend line by age group on the first page. On the next page, it gives me 3 different maps. First one is for all ages and total sex. This is for males, and this is for females. And last is just a simple table here with the county rates. And that's about all the time I have today. I could take a few questions if anyone has some questions about the EpiQMS data or perhaps some of our reports that we have out there as well. Does anybody have any questions? Yes?
Because the rate's lower, there can be a lot of other things behind that. The fact that people aren't being screened.
That's correct. And
or the young population. Or
the incidence data is really just one piece of this. Usually when people are doing research, they would look at other factors. Perhaps the death data would come into play. I know you often see certain types of cancers increase very dramatically. Thyroid cancer, for example, has been increasing dramatically since the 90s, and it's been increasing in Pennsylvania. It's been increasing also across the United States. Experts aren't really sure of the reasons for this, but if you look at the death data, it has been flat since 1990 and hasn't changed. So usually my first guess is to look at death data. There may be other areas like behavioral risk factors that we can look at, and there's really a lot of things that come into play when this data is being interpreted. Any other questions? Yes, in the back there.
Is there a spot similar to look, and if you mentioned this in the beginning, I apologize, but for staging data?
Yes, you can. When you're in our table module, or I think you can do it in the maps as well. You want it when you're using your rate menu up here. It will say % staging distribution. That just gives you the percent and also the frequency count of those cancers by stage. We also have something called age-adjusted staging rate. I didn't really do an example of that, but if I wanted to see late-stage colorectal cancer, it would give me an age-adjusted rate for that. And Here it's telling us that it's 25.6 for Pennsylvania. If I did the same thing for the percentage, then I would get 52% of them are at the late stage. Late stage meaning that it's a combination of regional and distant. Is there one other question I saw? Yes?
The data that's input for the, let's see if I can say this correctly. For the person, is the info where the person lives, like would it be their address or where they were diagnosed? So say I live in Berks County, but I went to Philadelphia.
Yes.
To be diagnosed.
It's based on residence address. We try to geocode the data, and I think we have a pretty high percentage that we're able to geocode. I think it's above 90% that we're actually able to get accurate street addresses to geocode, and it is based on residence. A lot of times people are treated at multiple spots, and we have to actually combine multiple records to figure out that it only represents one tumor. And but we use their resident address for mapping purposes or deciding what county they live in. Yes?
Questions. Anyone has access to this in the department or anyone in the public, or just people?
This is a public-facing website. This is all aggregate data, so there's no confidentiality data that you would pull out from here. They're pre-calculated statistics. Yes, in the back?
Yes, I apologize if you answered this earlier on, but for larger metropolitan areas where there's more diverse audiences, is there data collected from race and ethnicity? So,
We have data for Hispanics. Do you mean like... Yes, we have Hispanic data. When you're looking at our white and black data, that does not exclude Hispanics, though. I know some types of data on the census do exclude those, but we do have Hispanic data, and that is available, and it's classified under one of our race categories, but it would be Hispanics of any race. Yes?
That was my second question. Can
Okay.
you do that, for instance, if I would like to see in Reddit, which is populated for Latino, Hispanic, and Latinas, the incidence of cancer on Latinas in Reddit, is it possible to see that?
Yes. See, I'm just going to do some age-adjusted rates here. And some of our counties, we don't have the population data for Hispanic, but you should be able to get the frequency counts out of the cancer. I'm going to pull up all the counties so you can kind of see this. So I selected all the counties. I have colorectal cancer selected. And I'm going to go down to my race/ethnicity menu. And there's a note down here saying I think we only have data back to 2002 when it comes to Hispanics. So I'm going to choose Hispanic data, and we're just going to look at it by county. You'll see there's a lot of not availables here, and that's because we're missing the population. So we're not able to get rates. But if you look at the invasive counts here, we do have information on the frequencies, the actual number of cancers that were reported among Hispanics. Sometimes the numbers are pretty low when you're looking at a county level. For colorectal cancer, there was only 111 invasive cancers reported for Pennsylvania, and you can see how they're distributed here among the different counties. A lot of times we do not calculate a rate for two reasons. One, the invasive count might be too low, and the second reason is the population might be missing as well. If I look at, I'm going to do just a quick example before I wrap up by year now. I want to see which date of Hispanic we have by year. I think there's a note down here saying it's only 2002 and after. I'm just going to choose Pennsylvania. Now the Hispanic data our POP should always be available for Pennsylvania too. It's just the population's not always available at the county level. So you can see I selected all the years back to 1990, but the table is only going back to 2002. And that's when our registry began actively collecting information on the Hispanic data, I believe. Okay, one last question, and I think Julia wants to take over here, but go ahead.
I just have one. Is this all institutional reporting based, or is this a combination of data coming from multiple sources?
I think it's a population-based registry was the answer to that question, meaning that we get data from hospitals, laboratory facilities, doctors' offices, so there are non-hospital sources contributing as well.